Recognizing Coquitlam Millardville.
Thank you, Honourable Speaker. The government today announced that today is Seniors Care Providers Day, and in the gallery are some of the frontline workers who do their best to take care of our parents, our grandparents, and our loved ones. Unfortunately, this government isn't giving them sufficient resources to provide the care that our seniors need. Last year, the Seniors Advocate, Honourable Speaker, reported that only 18% of our publicly funded residential care facilities were meeting the benchmark of 3.36 care hours per resident per day. And last year, the Minister of Health said that they were going to do better. This year, that same report showed that only 9% of those same facilities were meeting that benchmark. Will the Minister please tell the House why his government is continuing to fail seniors as we look after our most vulnerable citizens?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, as I mentioned, the agreement that we reached with the federal government will provide additional increased supports for home care improvements in the province of British Columbia. And again, the members will see in the budget that we continue to increase the number of resources available for caring for our vulnerable seniors. Honourable Speaker, our Parliamentary Secretary has been working closely with the Office of the Seniors Advocate, with BC Care Providers, with other organizations around the province to ensure that the seniors here in British Columbia get the very best care, the care that they deserve.
Coquitlam Millardville on a supplemental.
Thank you, Honourable Speaker. Well, responding about home support, when in fact the question was about residential care not being properly funded for care, is really, I think, very disrespectful to the people who are actually doing that work here in this gallery. 91% of publicly funded facilities, Minister, that care for our seniors don't have the staff that they need. That's 91%. This leaves those in the front lines with moral distress and frustration about not being able to provide the care that they know that seniors need. Last year, when my colleague asked about this, the Minister said that staffing levels weren't much of a problem. When we asked about the 3.36 hours of care per day per resident, the Minister said, and I quote, "It's not a requirement, it's a guideline." So this government believes that adequate care of seniors is just a guideline. So why is the Minister allowing our vulnerable seniors to have less than adequate care, and when will he make quality care a requirement?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, the 3.36 hours per resident per day is, in fact, a planning guide that all health authorities should be working to as an average across the health authority. Honourable Speaker, seniors aren't widgets. They're individuals, and so their care should be based on an individual care plan based on their RISE score, Honourable Speaker. And in terms of home care, Honourable Speaker, I'm sure the member will learn that if you can support people in their home with more home care supports, that reduces the demand on residential care, Honourable Speaker. We are committed to our seniors in the province of British Columbia, Honourable Speaker, and that means that we'll continue to do the hard work necessary. Our Parliamentary Secretary for Seniors will continue to do that work. We will continue to make investments, and along with the deal that we have signed with Ottawa, Honourable Speaker, increase investments even further so that people can stay in their home, whether that's their home, whether that's assisted living, or whether that's residential care, in a safe and appropriate manner, Honourable Speaker.